Thank you, Madam Chairman. Dr. Califf, Abbott submitted its paperwork for reopening the Sturgis facility to the FDA on April the 8th. 7 weeks later, the facility is still closed. Do you have permanent inspectors every day in the Sturgis facility helping Abbott identify the contaminations that the inspectors found?
You have some incorrect information. Abbott did not submit adequate documentation on the date that you referred. That was only done on the last day.
Do you have inspectors today in the facility every day helping Abbott get the plant up and running?
We have inspectors working with Abbott every day as they're working on it. No, not in the plant,
okay.
No.
Why haven't you waived labeling requirements from trusted manufacturers in countries like the UK, Australia, or Canada? Couldn't manufacturers provide temporary labels on imported formula cans if the label is printed in a language other than English until U.S. manufacturing is restored? Some countries have higher nutritional requirements. Why can't we provide a waiver for their products to come into the country?
We've waived many of the requirements, the ones that make sense, but the directions have to be clear to Americans in language that's understandable so that the formula can be mixed up correctly. An error in mixing up the formula, for example, can lead to a very sick infant not getting the right nutrition.
Dr. Califf, complacency is apparently the FDA's catchphrase when it comes to infant formula. In FY21, the FDA received 42 submissions for new infant formulas. The agency was able to review only 15 of those submissions within 90 days. That's 1/3. What happened to the other submissions? Did you expedite the review of the new formula submissions when you took the helm at the FDA amidst a growing shortage? By law, the FDA has 90 days to review new infant formula manufacturing submissions. What's the average number of days it actually takes for the FDA to review these?
Senator Burr, FDA employees are working around the clock, and they are hardworking people, so I somewhat resent the implication of part of that. But
Dr. Califf, there's no member that's defended the FDA more than this one, and there's no member in Congress that has tried to fix areas when they are broken than this one. If you want to get into this with me, I'm happy to do it. I got 28 years worth of it.
I know you're quite capable of that. So let me just say, right from the start, any good application was expedited by the FDA since the shortage became evident.
So 42 minus 15, the rest of them were not good applications?
I think you were referring to 2019 or something you said?
No, it was FY21.
Yeah, I'll have to get back on the details on that.
Listen, the FDA Food Center, let's talk about it. It has a staff of 4,000 people, but according to your own budget documents, there are only 9 staff reviewing infant formula applications. Did you or other FDA leaders assign any staff to review infant formula as the shortage percentages rose sharply?
We pulled in people from all over the agency to help that short-staffed group, which of course—
To process applications.
I'll have to go back and see exactly how they spent their time, but looking at all of the activities of that group, they were supplemented by staff from across the agency, which of course means that other things didn't get done.
Do you have the authority as commissioner to move people around as needed?
Yes.
Okay. Dr. Califf, I've looked at an initial review of some of the activities of the Food Center, and I'm concerned with your prioritization of the activities with the staff you have. Since the voluntary recall, for infant formula, FDA Food Center spent time making changes to the definition of yogurt, opining on color additives in Antarctic krill meat, that's fish food, so farms can raise salmon that looks more pink, making announcements about the use of the term of the definition healthy. Since the first infant hospitalization, the same center has issued a rule on the definition of French dressing and issued guidance on cheese and chocolates that stray from the FDA's official definition. This is a pattern over the last decade. The same center has gone after salt, sprinkles, and even the definition of frozen cherry pie. So my question is simple in conclusion. What are your priorities at the Food Center?
The Food Center has a broad set of mandates, as you well know, but there's nothing higher priority than this particular issue that we're discussing today. It is the highest priority. We're assigning every resource that we can to work on this problem.
Well, I hope that the chair's request did not fall on deaf ears, that a detailed, comprehensive plan should be something that you could produce now if, in fact, the agency's working at the expedited pace that you addressed. If it's not ready today, I hope it's in the very, very near future. Thank you, Madam Chair.
Thank you. Senator